We're going to talk about 10 signs of liver disease that your skin gives. And folks, we have some risk factors that are associated with a higher chance, a higher likelihood that a person will develop a liver problem. What are these risk factors? Excessive alcohol consumption, presence, previous infection, infections with hepatitis B viruses, hepatitis C, or other variants of the hepatitis virus. The person, when they have hepatitis B and hepatitis C especially, this can generate a chronic inflammation of the liver. So hepatitis A is usually self-limiting, it's very quiet, but hepatitis B and C, if not well treated, they can become chronic and generate major problems in the future. But let's move on to the signs. The 10th sign is what we call jaundice, which is one of the most common signs of liver disease. And jaundice generally affects the skin, the sclera, which is this white part of our eyes, and also the base of the tongue. And what's the deal with jaundice? Jaundice is the yellowing. It's that person who has yellow eyes, who has yellow skin, who has the base of the tongue yellow. And this yellowing is due to the accumulation of bilirubin in the body. Bilirubin is produced when hemoglobin is broken down into indirect bilirubin. Once bound to albumin, it's transported to the liver, taken up by hepatocytes, which are our liver cells. And there in hepatocytes, it becomes direct bilirubin. It turns into a water-soluble substance, which we call direct bilirubin. This direct bilirubin is excreted by bile into our duodenum, which is a part of the intestine. So if you have a liver problem, this bilirubin ends up accumulating and generating jaundice. So jaundice is nothing more than the accumulation of bilirubin in your skin. So that's our 10th sign. Our 9th sign also has to do with this, which is pruritus, the itching. So when there's a dysfunction in bile secretion, there's also an accumulation of bile acids in the skin. So this buildup of toxic chemical products in the body, due to liver dysfunction, due to the issue with the liver, this can lead to intense skin itching. So the bilirubin deposited in the skin irritates the nerve endings, causing this itchiness. Our 8th sign are telangiectasias, or spider veins, which are small blood vessels that become dilated on the skin surface. So in the cover image, there's a picture of a telangiectasia. The design of a telangiectasia is these small blood vessels. It's like a dot, and it branches very superficially in the skin. When we run our hand over it, it loses its color and then regains its color. It can appear anywhere on the face, here in the chest area, on the abdomen. So they are small vascular clusters. These are telangiectasias. So they are small dilated blood vessels on the skin surface. The 7th sign is dark spots on the skin, which we call hyperpigmentation. This hyperpigmentation is caused by metabolic disorders that lead to the accumulation of bilirubin in the body and hence cause jaundice, which was our first sign. Jaundice can appear as yellowing or even as dark spots on the skin. This greatly depends on the person's skin tone. So, for a person with a darker skin tone, the signs of jaundice on the skin will not be as evident. The skin won't appear that yellow, especially if the person has a darker skin tone. But obviously the jaundice becomes much more noticeable. So, these dark spots are caused by metabolic disorders and also by liver failure, which results in the accumulation of toxic substances in the skin. And the itchiness and scratching can cause harm. So that person keeps scratching, scratch. This will produce a lesion, and then spots emerge from the scars or from post-inflammatory hyperpigmentation. So sometimes when we get a lesion, we get hurt. That area where the lesion was, it changes the color of the skin's tone. Additionally, hormonal dysregulation and the effects of some medications used to treat liver diseases can also cause hyperpigmentation. The 6th sign is tanned skin, but it's not tanned skin, the beautiful summer kind. That's not it. Aside from jaundice, the skin can also get a tan look because of problems in melanin metabolism. Melanin is what gives our skin its tone, so people with lighter skin have less melanin. People with darker skin have more melanin. And when the person has a liver issue, the metabolism of melanin is damaged, and then they could end up with tan skin even if they're not sunbathing. The 5th sign is skin lesions, which can take the form of nodules, pustules, or abnormal blood vessels. So we see there the person who has typically the cirrhotic, the person with cirrhosis, they have that jellyfish head circulation. So we look at the abdomen of a patient with cirrhosis, which is typically very rounded. This is the beer belly. An abdomen with ascites, with fluid within the abdominal cavity, that huge belly that looks like Santa Claus. And we there see the circulation forming as if it were Medusa's head. What does the Medusa's head look like? Those are little snakes. Medusa is that entity from Greek mythology. When people look at her, when the Medusa looks at the person turns to stone. And she had those little snakes on her head like her hair. And that's exactly how the veins look, right? The circulation of the patient who has cirrhosis. We look at his abdomen and we see all those veins, very protruding, very apparent, and we can see it. In addition, our fourth sign on the skin is what we call palmar erythema. It is the reddening of the palms of the hands, which can be a sign of liver cirrhosis. And this palmar erythema is also related to portal hypertension. It can also be caused by an increase in blood circulation in the region, by some disturbance in vascular regulation, in angiogenesis, by some dysregulation of the immune system, hormonal changes, or also by the accumulation of toxic substances. So all of this could be associated with palmar erythema, which is a reddened hand, right? A hand that you look at and say, oh, it looks like this hand is inflamed. It appears this hand may have suffered a blow because it's very red, but in reality, that's a sign of a liver problem. The third sign is white or pale nails, which indicate liver problems, anemia, and nutritional deficiency, traits very common in patients with liver problems. And they also suggest liver failure. Why? Because in liver failure, there is a reduction in protein production. So with this decrease in protein production, like albumin, which plays an essential role in nutrient transport within the blood, it's possible that that area is not receiving an adequate amount of nutrients due to a protein deficiency or a deficiency of some other substance, some other molecule that helps to carry what that area needs to survive, right? To survive properly. The second sign is petechia. Why are petechia? These are small red spots on the skin caused by subcutaneous bleeding. So, do you want an example of when people have petechiae? When a child has viral gastroenteritis, for example, a child who is vomiting a lot, or a child who ate something spoiled and is vomiting, feeling sick. Because there is a great effort in that area. Often some small vessels in the face end up bursting because the child is vomiting and then exerted a lot of pressure on the void, and then it generates a petechia, a red spot, which is actually a subcutaneous bleeding caused by some vascular rupture there. And petechia are related to clotting problems. And what does clotting have to do with the liver? Folks, the liver produces clotting factors. So it produces molecules that are essential for us to control the bleeding that may occur. And in addition, people with liver problems also tend to have what we call thrombocytopenia, which is a deficiency of platelets, okay? And now, folks, our first indication on the skin, which is also a result of portal hypertension, is edema, swelling in the legs and feet. Why is that? When there is portal hypertension, fluids leak into the nearby tissues. So when fluid leaks into the tissue, that tissue swells and becomes edematous. Furthermore, another cause of edema in liver disease is hypoalbuminemia. What was that again? The liver plays an essential role in the production of albumin. And the primary function of albumin is to generate what we call colloid pressure in the blood plasma. What does this colloid pressure do? It helps to keep fluids within the blood vessels. What happens when fluids are not within the blood vessels? Edema occurs, swelling. They leave the vessels and fill the tissues, thus leading to edema. So we see, for instance, a severely undernourished individual who has calorie-protein malnutrition. They also lack the ideal amount of albumin. And what happens to them? What we refer to as anasarca, which is edema generalized across the whole body. So folks, without albumin, when we have low albumin, it signifies liver function. So one of the ways, not liver function, liver problems. One method of evaluating liver function is by measuring albumin. So when the individual does not have albumin at ideal levels, they're going to swell. They're going to be edematous. Moreover, the person who has liver issues, they retain more sodium, retain more water. And also liver disease increases the risk of heart failure and congestion, something we've touched upon multiple times here, which causes swelling, particularly in the lower limbs. So lifestyle is the main tool, the best medicine, the best strategy for you to solve and prevent your liver problems. With that in mind, I've compiled into a single book the Longevity Code, 100 Habits to Live Past 100 Years, the 100 best strategies for you to have a very healthy lifestyle, which will help your liver, which will help control diabetes without medication, high blood pressure without medication, cholesterol without medication, and which will give you much more health, quality of life, energy, and will to live your life very well. So want to have a better life? Want to be healthy? Want to get rid of the meds? Want to be less stressed? Want to sleep better? Click now on the first link in the description or on the pinned link in the comments and get your longevity code.